In the darkest hours, even the tiniest ray of hope can give the strength to fight the toughest battles. The story of Dr. Sanat is one such story of hope and triumph against all odds. Dr. Sanat is one of the brave and selfless COVID warriors who put his life on the line to save others. Right from the beginning of the pandemic to the point he tested positive, the 30-year-old young anesthetist served with great compassion and determination on the front line.
So when he arrived in our hospital, he was already intubated, he was on 100% oxygen, but barely managing to have enough oxygen in his bloodstream to survive. So the first thing which happened on the day he arrived, within half an hour of his arrival, was he went onto a heart-lung machine, something called as an ECMO, to help him oxygenate the rest of his body. The ECMO was instituted almost within half an hour of his arrival into the hospital, and he managed to keep him on the ECMO running for almost a month. Now that period of time was a waiting game, waiting for an option of either his lung getting better or any other alternative like a lung transplant. Unfortunately, in spite of waiting for almost 2 to 3 weeks, there were no signs of Sanat's lung getting any better. So he ended up being listed on for an organ transplant for lungs if they were available in the region. Luckily for us, in another 2 weeks' time, a pair of lungs was available as a cadaveric donation for Sanat, and he ended up having a lung transplant. The period while he was waiting for the lung transplant to happen was on the ECMO, which is a very specialized equipment which keeps people alive by exchanging their carbon dioxide and oxygens in their bloodstream, and we are able to sustain them for long periods of time. Sanat's not been the longest on the ECMO, but he's been one of the most successful ones on the ECMO for us. And we've had a significant amount of experience managing these COVID patients who have gone on to ECMOs and who've had other challenges along with it. The story of Sanat is a hope for most of the COVID patients that there is some light at the end of the tunnel, and things like an ECMO or a lung transplant can be an alternative, but mainly suited for somebody who's young, who's fit, and who is able to go through the rigors of having such a procedure done.
Due to the extent of lung damage and life-threatening complexities of this case, the doctors at Aster CMI advised lung transplant as the last resort to save Dr. Sanat's life. With his indomitable survival spirit, Dr. Sanat became Karnataka's first ever post-COVID patient to successfully receive a double lung transplant.
A double lung transplant is a grueling operation, and it may unfortunately be the only solution for some patients who experience life-threatening combinations of severe lung damage caused simply by the COVID-19 virus and the patient's exaggerated immune response to it. This unfortunate coupling and the body's failure to prepare properly on time, this devastating injury can be very serious. Eventually, in this process of self-repair that normally happens in all of us, the deposition of yellow fibrotic scar tissue creates a liver-like density that makes the lung completely solid. This process of misdirected and inappropriate self-repair irreversibly destroys the tiny alveolar air sacs through which gas exchange happens. Patients really only survive to that fibrotic stage if they are intubated and at times transition to ECMO support if and when ventilation is found to be inadequate to support gas exchange. This harmful scarring can occur within a couple of weeks of that COVID viral pneumonia. Unfortunately, some of these patients, maybe 30-40% of them, suffer extensive and permanent damage to their lungs, making a double lung transplant the only choice of definitive therapy. Now, what makes this surgery uniquely complex is the fact that it is the subset of patients that are forced to accept this option. And most of them are intubated in the ICU for probably a month and a half, 2 months. They're deconditioned, and I mean they're severely malnourished, they're nutritionally inadequate, and they suffer from airway and bloodstream infections during their prolonged hospitalization. Many of them who have been on ECMO life support have additional challenges related to the long duration of ECMO support, which is generally also associated with an activation of their immune system and multiple coagulation disorders. The activation of the immune system leads to a greater possibility of rejection after a double lung transplant. Treating these very critically ill patients successfully with a double lung transplant personifies and animates the overall abilities of a high quality transplant program. And I truly believe that lung transplantation is very, very special, simply because it's probably the only transplanted organ that faces the dual challenge of not just the airway as we breathe, but also the recipient's bloodstream, making this surgery not just extremely arduous and difficult, but the recovery, its aftercare, and the long term stability, a compulsorily team based, vigorous, evidence based, and highly regulated process. I believe Aster DM Healthcare in Bangalore has all the synergies that I have always wished for a solid organ thoracic program to have. These synergies and efficiencies make our solid organ thoracic transplant program collaborative a successful one. Thank you.
The transplant team of aster CMI very helpful. They're excellent at what they do. Highly experienced people and very professional. I would also like to thank Dr. Mohan, who has been like a teacher for all these years. I would also like to thank the nursing staff, especially because I was obese when I got the COVID. They had to handle me a lot, and the physiotherapy team, and also my parents and family members. Thank you.
I met Sanath 2 years back, and he is not just a very good doctor, he is an extremely good individual. His all-round performance is very rare. A person like Sanath is very rare to meet. He does the entire comprehensive care of the patient, including all the treatment plans, modifications, counseling to the family, and he goes the extra mile, and he provides a very good care.
Now, lung transplant is an option that comes as a turnaround for these patients who hit the dead end. And increasingly, we are seeing that patients with chronic lung diseases who have hit the dead end and who have no other option but to replace their old lungs with a new pair of lungs tend to do better with the newer advances in the field of medicine. And also, we are seeing that they have a reasonable quality of life.
I would appreciate and the amount of effort what the family has also taken in terms of understanding the process. At the same time, help us to go to the next level where we were able to convince them whether should we go for a lung transplant, where that would be the option when the native lungs were not in a position to recover.
We took a little while in getting Sanath better. He's been with us for almost 3.5 months, and he was recently discharged home. And it was possible not only by us doctors, it was possible by the excellent support staff that we have, especially physiotherapy, our nurses, our dietitians. Obviously, all of this could not be possible without the family support as well. So after 3.5 months of hard work, helped by Sanath, Dr. Sanath, obviously because he was an intensivist and an anesthetist as well, so he knows exactly what to do. 3.5 months of hard work, we finally sent him home, and I wish him all the best at home.
Dr. Sanath's recovery is nothing short of a miracle and is a true testament of a COVID warrior.